Hello, ladies and gentlemen, and to discuss the impact of COVID-19 on mental health of international students and their parents and human beings in general, today we are joined by Dr. Poonam Modha, who is a doctor in USA and did her undergrad from MIT and her residency from Brown University. Dr. Modha, thank you so much for joining us.
Thank you. I'm happy to be here.
So, Dr. Poonam, what kind of impact can this isolation during COVID-19 have on the mental health of students and international students specifically?
Well, for all students, there's been an abrupt disruption to their academic year, not just in terms of classes and exams being delayed, but also extracurricular activities, um, dance classes, music classes, sports. And before, all of these interactions were happening in person, and now we've had to switch to online platforms. And I think that this generation of students is very good at the technology, but I think it's still tough on them not having that in-person interaction with their friends. And international students are facing the same challenges, but with the additional difficulty of having to deal with all these travel restrictions, as well as uncertainty around when it will be safe to travel and what that will look like. And of course, all of this is happening in the context of isolation, and that can bring up feelings of sadness, anger, disappointment, and anxiety. And this is something that all of the students are dealing with on some level or another. I think they can feel any one of these feelings or any combination, and it can be very overwhelming. Some people might have a sense of restlessness with the isolation, and other people might be feeling very bored and not really know what they should be doing. And all of those are valid feelings.
Dr. Poonam, to be honest, I think most of the people in these days are feeling like that. So at which point should one gets to know that it is too serious and they should seek professional help or probably see a doctor?
All right. So stress is a normal reaction to a change in the environment or a life event. And stress in and of itself doesn't necessarily have to be a bad thing. And in fact, it can be very helpful in some situations because it clues us in as to something is happening in the environment and I need to react to it. The problem arises during periods of prolonged stress. So if the student is experiencing sadness or anger, anxiety, fearfulness for several days at a time, that can be an indication that professional guidance is needed. If they've had significant changes to their appetite, sleep, energy level, concentration for several days, that can also be another indication. And for children, teens, and young adults, they might experience things like headaches or abdominal pain or other aches and pains. And sometimes these physical symptoms can be clues that there is an underlying mental health issue that needs to be addressed. And certainly if somebody's having thoughts of self-harm or suicidal thoughts, or they've actually gone ahead and taken steps in that direction, that's an indication that more immediate attention needs to be sought out. Substance abuse is very similar. It requires some professional attention, and resources are out there. Um, One key point that I'd like to make is, I think for all of us, if you notice that you've had a prolonged period of time where your function is decreased, for example, you're not able to get out of bed or tend to your normal self-care or your daily activities, or you've had a significant decrease in your interest level with those activities, that can be another indication that professional guidance is needed, and that treatment comes in various forms. And it's a decision that's made with the individual as well as the professional, and may involve medications or therapy or other modalities.
So, Dr. Poonam, what kind of precautions can one take if somebody is feeling like that?
I think that's a great question you're asking. I think this is a very important time to take stock of what we can do for ourselves to maintain our own well-being. And this goes for students and parents and everybody in general. I have a lot of thoughts on this topic, but the number one thing I can tell you is I think it's important to maintain structure during the day, maintain that routine. And for a lot of people, students and parents and everybody else, the routine that's happening now doesn't look anything like what it did just a couple of months ago. So we need to give ourselves that structure. So go to bed at the same time every night, wake up in the morning at the same time, have your meals at the same time during the day as well. Schedule your exercise or activities at the same time. Just really get used to that consistency. If you're somebody who takes medications, take those medications as prescribed. And if you have any questions about those, definitely contact your doctor. The other thing that's important to keep in mind right now is parents and students can collaborate as far as the students' studies. It's really important that students stay on top of their academics, keep their minds engaged. And I know you offer a great platform for that, where students can take tuitions in a variety of different subjects. So I hope people take advantage of that. And one more point I'd like to make is around technology. I think it's very important for us right now to limit the amount of mindless scrolling, as I like to call it. It can be very easy to develop a habit of going on all these social media platforms and just scrolling and scrolling or repetitively checking the news. And I think it's important for us to place some limits around that, especially in the evening time, specifically 1 to 2 hours before bedtime, when we really should be using that time to unwind. But by the same token, I think we're lucky to be living during a time when all this technology is available at our fingertips and allows us to stay connected with family and friends and loved ones and just check in on each other. In many ways, we're all in the same boat. And I think what will get us through this is taking care of ourselves as well as each other.
That's so true, Dr. Poonam. Thank you so much for your word of advice. On behalf of YB Solutions, I thank you again for joining us. Thanks again.
Thank you very much.